Hello friends, I am Dr. Parul Khanna, Senior Consultant and IVF Specialist, Nova IVF Gurugram. Today is 25th July and it is celebrated all over the world as World IVF Day. It is also known as World Embryologist Day. We celebrate it because it marks the day when the world's first IVF baby was successfully conceived and birthed by the process of IVF. We have come a long way in the past few decades where we began with only a success rate of 5% with IVF, and today we can see that around 50 to 60% of the couples who come to us conceive in their first or second attempt. So this remarkable success is mainly due to the technical advancements in the field of IVF and also the skill and medical procedures we are doing nowadays. So today I seek this opportunity to create some awareness regarding IVF. What is it? Who are the ideal couple who should seek IVF, and the couples, when should they come to an IVF clinic and get the treatment done? So we all know that IVF, it is known as In Vitro Fertilization. In common language, we also call it as test tube baby, ICSI, ICSI. So these are one and almost same terms for a similar procedure, that is IVF. So in an IVF procedure, what we do is we stimulate the ovaries of the female and we grow the follicles, wherein when they reach a certain size, we retrieve these eggs by an ultrasound guided procedure, and then these eggs are fertilized with the male partner sperm in the embryology lab under high magnification of microscope. The embryos which are fertilized are grown in the incubator for a period of 3 to 5 days before we transfer them back in the uterus. So when should you seek help from an infertility specialist? Any couple wherein the age of the female is less than 30 years and the couple has been trying without using any contraception for a period of 1 year. So these couples who have already tried for 1 year, they have failed at other methods of infertility treatment like ovulation induction or simple procedures like intrauterine insemination. So then they should seek help from an IVF specialist and inquire about the IVF procedures. Having said that, it is broadly divided into two types. When a patient comes to us for infertility, it could be because of multiple factors. One and the most common being unexplained infertility, wherein there is no cause in the male or female, as in why the couple is not able to conceive. So these form about 40% of the cases of infertility. So such couples who are not able to conceive either naturally or by other methods should seek help from an infertility specialist. Now coming to about male infertility. Male infertility contributes to around 50% of the cases of combined factor of infertility. Now these are the males who have very low sperm count. The term is known as OATS, that is either they have low count, low motility or poor morphology of the sperms. So these males can come to an IVF specialist. They can get their semen sample tested. Second is where the male is not able to ejaculate the sample. So absence of semen is another condition. These are very low, are very less in number, around 2 to 3% of the cases. But in these cases also we can do either TISA, micro TISA. These are some of the sperm retrieval technique wherein we remove the sperms from their testes directly, and then these sperms can be used for IVF cycle by ICSI method. Third is males with azoospermia, as in their semen has zero sperm count. So these patients also we can do the latest sperm retrieval techniques which I just mentioned, and then we can use their sperms for doing ICSI. Now when we speak about female infertility now, so female infertility contributes to 50% of the cases of infertility. Most common being PCOS, that is polycystic ovaries. So such females have ovulatory dysfunction. These females may fail to ovulate even with tablets like clomiphene citrate or letrozole or they have undergone ovulation but still are not getting pregnant. So then they need to go for IVF. Now, second being endometriosis, mild to moderate endometriosis or severe endometriosis, depending upon the treatment they have taken before, they need to go for an IVF. Third being bilateral tubal block. So in patients, female patients who have both the tube blocked, they cannot conceive with any form of natural treatment or even with IUI. So these females then need to go for IVF. Now, when we have said that, patients, either male or female, when they are looking for a third party reproduction, that is when they need donor eggs, donor sperms, or sometimes even embryo donation, then this can be done only with the help of IVF. Also, patients who have to undergo surrogacy, they wherein they have their own eggs and sperms and their own embryos, but then they need a uterus, then they need help for an IVF specialist. So these are some of the conditions which I have mentioned, but there are some other places which is beyond this lecture of mine. So patients who have previously genetically abnormal child, which is not life-threatening disease, but like conditions like sickle cell anemia, thalassemia, wherein these parents want that the second child should not inherit these disorders. So these patients then can undergo IVF, wherein we can test their embryos genetically. So that is all much about IVF. The success of an IVF cycle, this is very important because it depends upon how early you are seeking the help. The sooner the better, because as we all know that with increasing age of the women, the egg number, that is their ovarian reserve, and the quality of the egg declines with advancing age. So it is very important that you seek help at the right time. So for the couples who are getting getting married at a later age in their life, that is after 35 or in their early 40s, so you should seek help immediately, even before you are planning to have a child, and let the fertility specialist then help you that how soon you can conceive. Thank you so much. In case you are wanting more info about IVF and related procedures, do let us know.